Hi, I'm Jason Wasfy. I'm one of the medical directors of the Mass General Physicians Organization. I'm here with my friend and thoracic oncologist Inga Lennes, who is the Senior Vice President for Practice Improvement and Service Excellence. And so, Inga, I guess I'd just start by saying, can you just tell us a bit about your division?
Sure. So my division is a group of people who are internal consultants to both hospital and PO practices on the ambulatory side. My group helps practices to perform better in terms of their performance around access and the service that we provide for patients.
And then, so what can divisions and departments, for example, get help from your division?
Well, I'd like to tell you today about a series of initiatives that we have called sprints. We started in FY19 in Q1 focusing on something called churn, which is the patients that we book to come into ambulatory visits but then don't arrive into those visits. We want to minimize that as much as possible. So we took practice managers in ambulatory practices through a series of learnings and trainings to improve our performance on churn. And so we'll be looking towards other different themes as the year goes on.
So I guess what would you do for the next quarter, quarter two?
We're really excited about Q2, which is starting now. Q2 is focused on urgent access. So I'm sure the people who are listening to this have heard about the urgent need for urgent access across our institution. Our ED is at capacity. The emergency room has folks waiting to be seen. And from the point of view of the patient experience, patients call and are hoping for appointments, and so we want to do our best to make sure that we get them timely access to our critical ambulatory services.
So yeah, this is something that we all feel, and I feel particularly bad when patients eventually come in to see me and they're so thankful that the wait is sort of over. What can practices do as a practical matter to sort of improve access? This is so important, as you're saying, for capacity in the ED, for just patient experience, for our referring providers' experience.
That's right. We're really focusing on a few different areas. The first is phones. So many of our patients access our ambulatory units by calling us. So anything that we can do to make sure that we are answering our phones and messages in a timely manner and that we're doing it politely is important. The second focus that we have is on our schedules. So our group will be working with ambulatory practices across our hospital and institution to look at ways that we can improve urgent access. So slot in some more visit types that are designated for urgent visits using what we call blocks and specific visit types. This helps us operationally perform at a higher level. So we'll be working with the administrators in the ambulatory practices to configure our templates and our schedules to be able to accommodate the needs of patients.
This is great, Inga. Thanks so much for your time. I really appreciate talking with you.
Thank you.